Hello everyone, my name is Amir Hayal. I'm the Hematology Registrar. Welcome again in Daily Hematology Bleeps. Let's talk about platelet targets in different situations. As a hematology registrar, we usually receive bleep from the medical team and other teams, and they ask question, my platelet count is low, my patient platelet count is low. When should I transfuse the patient, or should I transfuse the patient or not? Or my patient is going for a procedure. Should I top up the patient platelet because the platelet count is low? So, uh, as a medical registrar, uh, you'll be doing a lot of procedures. The commonest procedure is uh, lumbar puncture. We will be talking about these procedures, which the medical registrar usually do during their routine on call. And we will be talking about some other situations as well where the platelet counts are low, and the usual question is, should we transfuse the patient with platelet or not? And also for the hematology registrar, it is important to know the platelet target because they have to advise the other team members and to support them. So the common procedure, first we will talk about the procedures. The common procedure is lumbar puncture. For the lumbar puncture, the PSH recommendation is keep the platelet count above 40. Um, I I should mention here that before mentioning the BSH guidelines about platelet targets, that every trust in the UK has their own local guidelines, and follow those guidelines first, because you have to follow your trust policy, local trust policy, and then you can think about something else. But for the FRC part 1 or part 2 exam purpose, if there is a national guideline, then the hematology registrar or hematology consultant has to follow the national guideline. Whenever there is no guideline, um, then we have to follow our local trust guideline, and we can mention that in the exam as well, that according to my trust guidelines, the platelet target for this thing or in any other situation, the platelet target is this much. Because multiple trusts have different values for the platelet count. So let's talk about first the common procedures that are done in the hospital, and you receive a call from the other medical teams, uh, and they ask you what should be my patient platelet target, or should I transfuse the patient with platelet or not? So as you mentioned, the common procedure is lumbar puncture in patient. Uh, the recommendation, BSH recommendation, is to keep the platelet count above 40. If the platelet count is less than 40, you have to transfuse. If it is above 40, then it is safe to go ahead. But um, before uh, acting on this decision, your trust guideline may say 50, so better to check your local trust guideline as well, and local hospital guideline as well. Then another common procedure which is done a lot in hematological and non-hematological procedure is the central venous lines insertion. For them, the recommended platelet count is about 20. Maybe the guideline says, local trust guideline says about 40 or 50, but the BSH recommendation is if your platelet count is about 20, you can go ahead with the central venous line or central line insertion. Then the gastroenterology or the colorectal people, they are doing OGDs, and if the platelet count is low, they ask you, when should I top my patient, or my patient platelet count is low, I want to transfuse this patient with platelet. What should be the target? So for OGD, whether they want to do biopsy or not, but especially with biopsy, the platelet count should be above 50. So for OGD procedures, the platelet count should be about 50 from bronchoscopies if they are taking biopsies as well. And for general bronchoscopy procedure as well, the platelet count should be about 50. Likewise, if the patient is going for any liver biopsy, the platelet count should be about 50. Then the obstructed people, they do epidural anesthesias for their patient. The recommended BSH recommended, British Society of Hematology recommended platelet count is about 80. So if the platelet count is about 80, they are safe to go ahead with epidural anesthesia in the pregnant lady. But if the local trust guideline says keep it above 100, then you should keep it above 100. But the BSH recommendation is British Society of Hematology UK recommendation is to keep the platelet count above 80. Then you can give your patient, pregnant patient, epidural anesthesia. If there is any neurological surgery, patient is going for any eye surgery or brain surgery, central nervous system or peripheral nervous system, I mean the central nervous system, not peripheral, then the platelet count should be above 100. So in neurological surgeries, platelet count is above 100, and um, in if we go again list wise, in central venous catheters, platelet count should be about 20, in LP about 40, in OGD and biopsies about 50, in epidural anesthesia it should be about um, 80, and in neurological surgeries, neurosurgeries, it should be about 100. One thing to note that according to British Society of Hematology (BSH) guidelines, the pediatric lumbar puncture need platelet count about 20. But again, I would say check your local guidelines as well. Both those who are advising the pediatric people and those who are um, getting the opinion from the hematology doctor. Then there are some situations where patient is not going for surgery, but the patient platelet count is low, and the medical team want to ask, should we transfuse the patient or not? In that situation, generally, if the patient is septic, patient is on therapeutic antibiotics, and the platelet count should be about 20. So when they go down below 20, then you have to transfuse the patient. Normal platelet count is 150 to 300, but they can decrease with severe sepsis, DIC, uh, and antibiotics. There are multiple factors that can make the platelet count very low. So if your patient has sepsis, patient is on active antibiotic, therapeutic antibiotic, keep the platelet count about 20. If the patient is having platelet count low, less than 10, okay, and the patient is um, not having ITP, and patient is not bleeding, then usually we do not transfuse in ITP. This is the only situation where you should talk to the hematology doctor first, whether should I transfuse my patient or not. ITP patient, platelet count less than 10, not bleeding, there is no indication of platelet transfusion. Yes, if the platelet count is very low, 2 to 3, and patient has bleeding, yes, patient need platelet transfusion plus other hematological intervention as well. I think the only one situation where the medical team would see very low platelet count, less than 10, would be the one where the patient has either metastatic bone marrow involvement or patient is on aggressive chemotherapy. Those will be the situation where patient would have very low platelet count. These are usually hematology or oncology patient, and they are usually dealt by the hematology or oncology team. Such patient will be very less likely to be dealt by the medical team. Again, if the patient has minor bleed, like epistaxis or gum bleeding, it's better to keep the platelet count about 30 if the platelet counts are low. And if the patient has severe bleed, then it's better to keep the platelet count above 50. to prevent further bleeding. Then comes the DIC case. DIC platelet target is different in different trust. My previous trust says that if the platelet count is above 50, that is okay. But current trust says that if the platelet count is above 75, that is fine. Below 75, you have to transfuse. So there is trust to trust variation, but the BSH guideline says that we have to keep the platelet count above 75 in DIC patient. So that's why I'm stressing on local trust guidelines, see what they say. And if there is none, ask your hematology doctor. If none or not, and you are not satisfied, open your trust guideline. Again, if a patient has any neurological bleed, like enterocerebral bleed, then the platelet count should be above 100. If there is any brain injury, then the platelet count should be above 100 as well. And if the patient has a trauma and there are multiple fractures, then the platelet count should be above 100 as well. So these are the few values, common values that you will face during your hematology on call, or that will come to you as a medical registrar in the ED or during your uh, uh, jobs during the hospital, and you will be asking from the hematology doctor as well, or hematology writer or consultant as well. So if you can make the list of these platelet targets and keep it in your office, it will be helpful. But uh, if if you are not sure, not confident, then yes, you have to ask from hematology registrar or consultant. And for hematology registrars, better you should make a list of these targets as well, so that in case of on-call or emergency, if you are out of the hospital, you can refer to the list easily. Now, there are some procedures which do not need platelet transfusion, and platelet targets are not necessary out there, even if they are low as well. For example, in hematology, bone marrow biopsy procedure usually do not need any bone marrow, bone marrow biopsy procedure do not need any uh, do not need any platelet transfusion. If a patient has a cataract, then no need of uh, platelet transfusion and cataract surgery. If a patient has DIC and there is no bleeding, then no need of transfusing this patient. DIC patient needs blood transfusion only if there is bleeding and the platelet count is less than 75 according to BSH guideline. PICC line insertion usually do not need platelet transfusion as well, but practice sometimes is different. Local trust guideline says that, or local hematology consultant may say that, yes, top the uh, patient platelet up and make it above 40 and then insert platelet line. This is local practice. For hematology registrar, if you are appearing in FRC part 1 and part 2 exam, you have to remember the BSH recommendation, because there are BSH recommendation available for platelet transfusion, and they have mentioned different targets. And for the medical doctors, if they have any confusion, they should contact the hematology registrars and consultants and ask them. But this was a general discussion to make you aware what are our different platelet targets in different procedures and in different situations, and which of the um, procedure do not need um, platelet transfusion. So see you again in Delhi Hematology Bleep. If you want to reach me, you can post a comment under the in the comment section. And if you have any question, you can ask in the comment section as well. The hematology registrar can put can ask their queries in the WhatsApp group that we are having. And see you again with a new hematology discussion. Thank you.